All right. Well, good morning, everyone. I've got 9 o'clock. We will rock and roll here. Thank you very much for being here live on the call this Monday morning after Valentine's Day. It is President's Day. We are working. The banks and post office are closed, but there's good work to be done in our community to help seniors and our community connect with health insurance. So as we normally start, we are here to improve the lives of our community with affordable health care. Thank you for being a part of that mission. And again, thank you very much for being on this call live. Keep in mind that this is being recorded and posted on YouTube as well. So if you do miss a call, or if you know someone that missed a call, or they want to get caught up on these calls, please make sure that they go over to YouTube. You want to subscribe to our channel, Health Plan Markets. I think it's Health Plan Markets FL. It should be pretty easy to find. Subscribe there and then click the notification bell so that way when we do post a new video or it goes live, you are notified. So that is the deal. That is a trick. That is how we stay up to date. So with that, I do want to share with you a couple of HQ updates this morning. So I'm going to bounce over first to our training calendar. As we normally do, this is our training calendar here. I am a week ahead, so I'm going to go out here back to the week. So later today, we've got some trainings. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times, even during the slower time, AEP, OEP, whenever we can, to ensure that we know what we're doing, because your clients are going to ask you questions or you're going to need help with something. And if you don't know the answer, you're going to look like a dodo bird. So no dodo birds around here. Later today, we've got marketing your business with social media. There's a great class right there. That's at 1 o'clock. It's about an hour. Also later today, Cigna's doing DSNP plans, talking about their DSNP plans and some retention there. So that's at 4 o'clock today. Also of note, Devoted's doing an open training class at 11. We've been getting some great emails from Devoted. If you are in a market that offers Devoted or you're contracted with Devoted, they are doing some awesome training and outreach for the community, especially for marketing. So if you're looking to expand, grow your book of business, find new clients, prospects, and leads, then I recommend that you connect with Devoted because they are aggressive right now. It's pretty cool. So check that out. Also, grassroots marketing, can't ever get enough of that. It is a Rubik's Cube of success, but you really have to know how to get out there, get your name out there, and roll up your sleeves. That's at 2:15 tomorrow. We've got our very own Al Clancy, Ask Al. He's available from 9:30 to 10:30 every Wednesday. Your virtual coach, but he's a real person. He's not AI, he's Al. So Ask Al, he's there. 9:30 to 10:30, bring your coffee, and he's happy to help there. Also at 9:30, if you don't quite need Al, they're doing a member engagement training at AvMed, pretty cool there. We've got our virtual hours, question and answers for contracting from 11 to 12 every Wednesday, so you've got that. Also, Humana at the same time is doing their Part B reimbursement Give Back 101, if you need to learn more about that. WellCare election periods, they've got a cool little video. You can watch that. We posted it there. That is on demand. They will be in our office on Thursdays from 9 to 11 every Thursday. So if you have any questions, or again, if you need to connect with somebody that knows the business and can help you grow, if you want a leader, if you want someone that's walked in your shoes and you want to see success in your career, then it's always good to meet new people. So Susanna from WellCare is here on Thursday. She's spending her time, energy, and I hate to see it when very few people show up for such a great person that can help you grow. So come on in. The office is open. The water's fine. And we'd love to get you connected. If you're not quite close enough for Orlando, that's fine. We can definitely help you connect with a WellCare manager if need be. Then we got some rapid fire here. We've got Health First doing pharmacy highlights. They have a lunch and learn in the Orlando market from 12 to 1. Health Sherpa's doing an online training. That's on from 1 to 2 on Thursday. United's doing a Part D training from 1 to 2 on Thursday as well. HQ training available from 3 to 4 every Thursday. And then we've got Cigna doing their compliance deep dive. Always fun stuff with compliance. What about shop 9:30 if you need help with our quote and enroll tool for Medicare, which we're going to talk a little bit about this morning. That is available at 9:30 every Friday, along with our friend Tom Ryan here. He's going to help you get rolling. Cigna's doing enrollment periods training from 10 to 11 on Friday, and then UHC grassroots marketing at noon. So that's the training for the week. Remember, guys, keep one foot in the classroom and the other one in the field. What I am referencing here on the screen is HQ. You go down to Learning Training Calendar. So you guys have this at your fingertips. If you don't have HQ, please reach out to us, support@askhpm.com, and we'll get you set up. You do have to be contracted with us. So if there's anyone that's not yet contracted, it will come in time. So we'll get that rolling for you. Speaking of contracting, I do want to make everyone aware that we are revamping our entire contracting workflow. We are getting better. We are getting ready to scale. And one of the things that comes with it is a little bit of bumps in the road. So I just want to be very transparent with you on that, you know, we are switching systems pretty quickly here. But if you do need a carrier and you need to add a carrier to your portfolio, you would go down to contracting all HPM carriers, and you can scroll down and pick the carrier that you need. And once you select that carrier, let's say it's devoted, it will show you what states that they are in and whether you're starting a new contract or you're transferring your contract over to align with health plan markets. So when you click that, it should give you instructions on what you need to do in order to get contracted right there. Once you click Start New Contract, it'll send a note to the contracting department, and they will get you rolling on that specific health plan. So if you need to add that, you know, pretty easy to do without having to get jammed up to get started there. All right. We have cleaned up HQ just a little bit. You'll see some changes. We've simplified some things, and we've also combined some things as well. So when you have a moment, go ahead and explore and deep dive a little bit more into HQ. Remember, we love feedback. If you have an idea, a question, or concern about how our all-in-one agent platform is working, please click the feedback button up at the top right corner. It's purposely in purple so you can catch it, and just drop your note right there and hit submit. We love feedback. It's really, really important for us to continue to iterate and make sure that we have a really great system for you. Okay. All right. Moving on down. Want to talk a little bit more about our culture here at HPM. And in case you haven't been over to our main website in a while, I'm going to start there. And we do have a great video that we posted here on our main page, which was well done from our marketing partner. But one thing I do always like to kind of touch on these days is our culture. And I think last week we talked about the AEP contest and the AEP kickoff, and kind of going through who can get into what. And we've got a pretty big gala coming up in May, and I want to make sure that you are aware of it. This is an invite-only gala for our top 50 performing agencies, and some folks that need to be celebrated for their hard work here at HPM. It is a very limited event. I know some of you will hear about it. Some will be invited, some may not this year. And I want to be very clear that the intention of this particular event is for the very top performing agents and agencies. And we will have other events for all of you, especially our AEP kickoff, our monthly advisor meetings, our top producer dinners, and then we're always doing some fun stuff in between. So, you know, this particular one is to recognize the hardest, most dedicated agents in the business here at HPM, and they will be appreciated and awarded for their very hard work. So I just don't want to make anyone feel that they are not important here, because that's not what this is for. This particular event is for those folks that have figured it out, that have been working extremely hard to stay at the top of their game. And for the rest of us, including myself, it is a reminder that you can definitely do it. You can definitely get there, and we want to encourage you guys to get there. Some of you may be invited for the first time. Some of you may be invited to our 4th annual gala, which is this year. Can't believe it's been 4 years already. And some of you may have gone in the past and just didn't quite cut it this year. But it's one of these things that keeps the competition alive, keeps us motivated, keeps us working in the right direction. But most importantly, it's good to gather around those folks that work very, very hard at their craft. So it's a little bit of encouragement that I want to make sure everybody is aware about, because I wish I can have everyone there. I really, truly do. It's a fun event. It's black tie. It's in a beautiful location this year. But I can't invite anybody or just everybody. I have to make sure that, we're recognizing, the ones that are mastering their craft for this particular event. We've got other events, so don't panic. We've got some great stuff coming up for everyone else as well. So moving on, last week we talked about NABIP and specifically that particular membership. It is going to be we get I think it was $100 off the annual membership that I mentioned I think about 2 weeks ago. And some of you had requested membership packages or applications. You have been sent those applications, but we haven't have you sent them back. So remember, NABIP gives you incredible value. They are lobbyists. In fact, next week I'll be going to Capitol Conference in Washington, D.C., and we're going to be meeting with lawmakers and lobbyists, and we're going to be working hard to continue to grow that particular movement. And so as independent agents, if you're not part of NABIP, thank you, Dave. Dave is running our Central Florida chapter. So if you're looking to join, please do that. Thank you for the link, Dave, but I don't know if that's the same discount. But either case, we'll get you the discount. If you want to go ahead and click that through Dave's link there in the chat, go ahead and do that. But just ping us to make sure that we sync and link that discount for you, because Anne-Marie worked hard on getting a discount for HPM. And right now we have an exclusive discount for NABIP. And we definitely want to make sure that you're working towards that discount. So you can check out the membership with Dave. He's saying that one doesn't include the discount, but please get an application from us. Just again, shoot it over and I'll put it in the chat, support@askhpm.com. Again, some of you have requested the application, but we haven't gotten them back. I'm going to have Gabe chase you down. He knows who you are. So Gabe, I know you're listening. If you can track those folks down so we can get those applications turned in. We do have a special guest that we're going to be bringing on here in just a second. I'm looking for Jordan. Do I see Jordan on here? Nick, I don't see Jordan. Maybe if you can track her down, would really appreciate that. Okay, so he's going to work on that. If not, I got plenty to talk about. Let's talk about OEP. And going back over to HQ here, once you log into the front page, I'm going to show you again that you have the ability to see what's going on in the industry by jumping your inbox. We realize that not every email is there for you to read. Sometimes you glaze over it, sometimes you miss it, sometimes you just ignore it, sometimes it goes to spam. We get it. But one thing that we've done is last week or the week before, we created an OEP cheat sheet. So this little blog here that I created just gives you a quick overview again of what you can and cannot do in OEP. Okay. So couple of no-goes is no unwanted ads. You can't send emails proposing a switch during OEP. You can't promote OEP as OEP. You can't target a list of people that signed up during AEP. No OEP sales pitches. Again, we talked about that. And then no calling past clients. So if they disenrolled, you can't call them and again, you know, ask them to switch back into your book of business. You can do a survey, which basically is, hey, you know, can I ask why you left? What plan did you go to? Was there something that I did wrong? That kind of thing. But you can't, you know, push into an enrollment. That's just not a thing. You can't do that. So you're more than welcome to mail them, keep them on your mailing list. One thing that I used to do back in the day is I had 2 lists. I only had 2 lists. If I met you, you were on, and you were eligible, you were either on one of my lists or the other. Okay. And the first one is you're a prospect, right? So you're a prospect. You're somebody that showed interest. I'm trying to enroll you, right? You're a prospect. So that you're on my list. And I'd grab your email, phone number, address, whatever I've got, you know, I'm gonna grab it and you're gonna go on my prospecting list. Okay. So got my prospecting list there. And the other list that I had, and the only other list, was my enrollments, my clients, the ones that are tied to me. Okay. So when I did an enrollment from my prospect list, I would move them into my client list. And if a client disenrolled, I would move them back into my prospect list. Okay. Now, if I had consented contact, of course, I can reach out. You know, doing Medicare specifically, I can reach out. But if I didn't, then I would note that, and then it would be like a mail only situation. I can mail them, I can email them. I can't call or text them, but I can mail them and email them. And sometimes people would say, thank you for that. I want to come back, or I want to switch, and they'd move back into my client list. Forever and ever, unless somebody passes away or moves into an area that I just can't service, they would never be removed from my 2 lists. They'd be in one column, or they'd be in the other, and that was that. So I am going to later down the road here, and I think next week I'll announce it, but I am going to create a training for lead management. And I find that the more people I talk to, I find that there's really not a system, or there's really not, you know, people are not so great with lead management. Everybody on this call, and you can put it in the chat if you think I'm crazy, but I'm sure everyone in this call would like to have leads, right? If you're not interested in leads, post it in the chat, and then we could talk about that. With that, though, I do see that Jordan finally joined us, so I'm going to make her a presenter, and hopefully, Jordan, when you get that little ping there, you should be able to take over, and we'd love to have you on. So we're going to give her a second to get loaded. And I see some chats coming in. So Bud says you're not crazy. Appreciate that. There she is. Jordan, how are you? I know you're connecting. Do you have audio there?
I think so. Can you hear me?
We are good. Okay. So thank you. I know you're on another time zone. It's been kind of crazy coordinating. So I really, really appreciate you being on this call. I know it's early for you. So let me introduce Jordan from SelectRx. And we have a new product, or a new part of the Connector platform, HPM Shop, that is really going to bring you massive value for your clients. And it only takes a few more minutes to explain this program for their pharmacy, and really protect your clients, because a lot of things that are happening in OEP are people going to the pharmacy and they're getting sniped. Your clients are getting sniped. So if you have them onto a mail order program like SelectRx, it's going to make a huge difference. So with that, Jordan, take it away.
Sure. So no one here has heard of SelectRx yet. Is that correct? Or
I think
are they
they're all,
seeing
yeah,
this
it's safe to say that most of them are going to be brand new to this.
Okay. Okay, great. Then I will start at the beginning. I will share my screen. This is my first time in Zoho, so bear with me.
Yeah,
I think
take your
got
time.
it though.
Yeah, this is really a test on your tech skills, and you're doing awesome, by the way.
Are you seeing it?
Beautiful.
You are? Oh, great.
Yep.
Okay. I don't see it. So if something looks off and I'm talking off track, someone please raise your hand. So first, you may or may not have heard of SelectRx. We are a part of a larger company that's called Healthcare Select. For the purpose of our relationship, I will, and the time here today, I'll probably skip over everything that Healthcare Select does, because all that we'll do for your customers is help with the SelectRx portion. This is a mission, vision, purpose. Again, I won't bore you with this, but Healthcare Select generally just wants to help make people's lives better and healthier. Like I said, SelectRx here, please go to our website, check it out. It'll tell you a little bit more about the product. That I'll tell you today too, but we are a part of Healthcare Select. So when we go to a transfer script, and I share that information, that's why you'll see going to transfer you over to a Healthcare Select representative. They offer SelectRx. Just know that's the relationship there. So SelectRx, you may be wondering if we're accredited or not. We are an accredited patient-centered pharmacy. This is a lot of words on one page, but I think the next slide is a little bit more telling on what we do. And really our whole value is this nice, pretty little box that your customer would receive each month, which has their medications all sorted out by time of day. And again, it's on a monthly basis. So all of this delivery, everything is included in the service. This should be cost neutral for your customers, so long as they are on an accepted plan, which we'll get to further in this presentation. Today we just released, we have over 100 or just under 100,000. I will say it's a little bit over now. That was December's end of year. So lots and lots of testimonials and things I could share. I hate to say it's an easy product to sell, but the value is so good here. All of our pharmacists are in-house. So your customers, once they're transferred to us, they will meet with one of our sales representatives who will enroll them in SelectRx. And then that is pushed to our pharmacists who go over, they check all their medications, they make sure they're not taking, maybe they're taking a generic and then a brand name pill, and it's the exact same, but no one knows because it was two different doctors. They didn't do their checks. They may be picking them up at a different pharmacy or at least a different time, and those things can go unnoticed. Since we have pharmacists in-house that handle all of that, we like to say that we are better at keeping them safe and healthy because we are doing all of those checks and make it really easy for people to take their pills. Mm-hmm. I know personally, we were on a track of taking like 12 vitamins at one time, and me being young and sorting out all of those pills, half of them still look the same. Luckily, there's not a very high risk in doubling your dose of like vitamin C, but with some of these medications that some of your customers are likely taking, there is a big risk there. So really important that we're doing that and not your clients. And again, we make it really easy. It's shipped to their doorstep. vitamins can be added into these packets. We do have a prescription minimum, and which is 6 prescriptions or more. Vitamins can be added on top of that, but we can get to that in the next slide. I don't know if everyone here can talk, or Justin, if you had any questions that maybe I could answer right off the bat.
Yeah, I'll run the chat for you. And again, if you guys do have questions about SelectRx, just go ahead and pop them in the chat. So the first one's from Elisa. She's asking, is SelectRx nationwide?
Oh, great question. So we are in everywhere except for Arkansas.
So 49 states.
And I will get over to the next slide. Well, I'm going to skip this slide. This is everything I just said. It's a little bit better of a view, and I'm sure Justin can share a couple of these views with you after the presentation. Poke through it, get to know it a little bit better. This is more words. Here are our highest opportunity for education, or AKA people that are going to qualify for our product. So these folks do need to have Medicare Parts A and B, which luckily for you guys, almost everyone you're talking to should. They need to be on 6 or more prescriptions. Like I said, there's a sub bullet here. You can add over-the-counter medications or vitamins to this number, but they would need to be on 6 or more prescriptions. And I think for the most part, you gather some of this information in your pitch itself. So hopefully this is kind of an easy add-on at the end. And then we offer for all plans except Humana, Cigna, WellCare, Kaiser, and Priority Health. So we do accept UHC, do accept Aetna. So there are definitely some bigger players in the space that we are on, and I know you guys are talking to several of them. Any questions here on who qualifies?
I do have a question. So, they're new to the program, and so how does the coordination get set up between the pharmacy and the doctors, as far as the scripts being transferred, and how does that, that first setup, how does that normally work?
Yeah, great question. So that's another thing that we handle. So we will handle all of the communication with the doctors. We do not expect your clients to go and hand them this paper or try to coordinate getting everything swapped over. We take that on. As far as exactly how it gets done, I would need to ask. But I know we handle all of the coordination that we can. Now, if the doctor is really hard to get a hold of, or we've tried for a month and we can't get a response back, I know that there's some communication that we can shoot out to the client and just say, hey, next time you're in, mention this, and that can help. I think that's pretty rare, though.
Perfect. Another question came in. Do you accept regional carriers such as Health First? And that's a plan here in Florida. They are on Connecture, so would we assume that they're in?
Yes, I'm sure we do. I don't know that one off the top of my head. I do have a list that I'm unable to share with you guys. It's very exhaustive. I could check on that one. But as far as I know, these are the only exceptions we have. But if you do run into some, I won't say that a very, very small random carrier sometimes wouldn't work. So I welcome your guys' feedback if you heard that from a customer. Can you repeat the name of that one specifically so I can do that check?
Yeah, it's Health First.
Health First.
Yeah, and there's 2 Health First. There's one in Florida and one in New York. So we're referring to the Florida one. Yeah.
Yeah. Okay.
And then another question is, does the exception also include Care Plus? Care Plus is a company owned by Humana. They are run by Humana. So I'm assuming that they kind of fall under the Humana blanket for. Yeah. Okay.
Likely not.
Okay. Now, can you take us through the process on where they would introduce this particular program to their clients? Like in the process of, the enrollment, I guess.
Sure. So, and all of your folks, are you guys handling your own enrollments? Yeah. Okay. So really, it would be at the end of your enrollment pitch. You guys would enroll them in your plan, and then you would know after that conversation, enroll or not. So I should back up. We are absolutely open to no sales or post sales, and both of which you likely know the plan they're on or are moving to. So we are open to both of those transfer opportunities. Obviously, the placement of when you will pitch this will depend if it's a no sale or a sale. But if it is a sale, it would be at the very end of your call. We do not want to disrupt anything you're doing or influence anything you're doing to enroll them in the right plan for them. After the right plan for them is decided, then you would know if they are on an accepted plan. And for those folks, you would then go into this transfer scripting. We have moved to a cold transfer environment that should save you guys a little bit of time, and sometimes just some of the fuzziness and that transfer, speaking over each other, etc. So both of these scripts are cold transfers. I will read them verbatim since you guys have not heard these before. I will try to keep it enthusiastic. I understand you are taking 7 prescription medications. Most individuals taking that many medications have trouble managing their meds, even if they are using a pill sorter. Some individuals may struggle with staying organized, remembering to refill their medications, or have difficulty leaving your house. You guys will know this as a part of your conversation if they struggle with any of those things. This is informing and educating them that there are subscription pharmacy services that will sort and deliver these in easy to use time of day packaging, and provide additional services as far as working with their doctors, etc. These type of pharmacies make it easier for people to manage multiple medications, provide regular medication reviews by pharmacists, and work with your doctors to help make sure you're taking the right medications. Many of these services also provide extra support like behind-the-scenes assistance and working directly with the doctors and insurance to manage refills and save you time. These services are available at no additional cost to you. Again, important they're on a plan that's going to qualify. We partner with a company called Healthcare Select, who has several services, one of which is a medication management full-service pharmacy called SelectRx. Do you want to learn more about this? Yes, of course I do. And then you guys will say, great, I will place an inbound call on your behalf to a Healthcare Select rep now. And then there are little differences here, which I will explain whether it would be a post-sale or a no-sale. So if we're in a post-sale environment, these are folks that are obviously moving to a different plan. So it is important that that plan that they are moving to is the plan that we hear. We do not need it because they should be moving to an accepted plan. For an example, let's say that you get a call and a customer is on Humana today, but they're moving to a UHC plan.
Mm-hmm.
We want that consumer because they're moving to a UHC. We wouldn't want the vice versa because retention wouldn't be great, right? Because they're only on UHC for, in this case, a couple more weeks. So in a post-sale, you want to inform the customer when they ask who your current Medicare carrier is, you can let them know that you're moving to a UHC plan on the March 1st.
Mm-hmm.
We want you to inform the customer of this because sometimes the customers, as you know, on a post-sale, they could say who their current Medicare carrier is instead of who the accepted one is, and then we could disqualify them based on that response, and we obviously don't want that to happen. And then a no sale is similar. You just say when they ask who your current Medicare carrier is, you can let them know you are on a UHC plan. And then you will disconnect, and we will take it from there.
And you may not have a slide on this, but it's going to show up in Connecture if you haven't already seen it in the pharmacy section, I believe, when you're selecting your pharmacy. We've activated that on our platform. So if you guys have seen that during the enrollment process, that's why we're here today, is to explain that exact section of the enrollment process if you've seen that. So that's what that is. And I know some folks may kind of be in a rush, Jordan, to like get some stuff done. Is it okay for them to give a number to the client to go ahead and do it on their own, or?
Yeah, so I can provide you guys with a script for that, or there does have to be the educational piece. I would love for this script to be 3 sentences because
Yeah.
I'm in marketing. But compliance, we do have to have the educational piece. So as long as you guys, it would likely look just like this, or there are 2 options. This is another script that one of our partners uses that works really, really great. So I will send you both of these options. You guys can kind of feel them out and see which one works best for you. I can provide a third option where you would say all of the same thing. You say, would you be interested in learning more? Yes, but I don't have time today, or whatever that may be. And then you guys can simply let them know the phone number, and you guys are more than happy to call in.
Now, what would you recommend for, let's say we enrolled somebody in AEP that, you know, they've been on the plan, they call us and they say, hey, look, I really am struggling with my meds, or I don't like my pharmacy. And then, you know, our team is like, you know, we just learned about SelectRx. Can we connect outside of the enrollment process, I guess, is the next question for existing clients.
Absolutely. Like if they're going to your care team or something like that.
Mm-hmm.
Yeah, absolutely. Now, I know that might not be super easy through Connecture,
Right.
but you guys are more than welcome to use the same script and use that same phone number and transfer. I'm not sure how you guys are planning on actually using these scripts, if it's going to be a document you guys have on your laptops just ready. But yeah, you could use that same phone number and probably paste it in the top, and that's more than fine.
Yeah, and we'll have this in our training documents as well. So we're building out a new platform, and this was going to be part of it. So they'll be able to get the scripts from there downloaded and keep it wherever they need to keep it. There's a question that came in, MP3, and this is referring to the Medicare prescription payment plan. And I could take this one, Jordan, because the pharmacy is really not involved in the prescription payment plan, the MP3. It's actually the payer. So for instance, let's say that your member's enrolled in Aetna, they have SelectRx, and they want to enroll in the PPP program, the prescription payment plan program. They would actually coordinate that with Aetna. It doesn't affect their pharmacy. So they could still get their meds from SelectRx. SelectRx gets paid by Aetna. The actual MP3 program runs through your prescription payer. So just want to make sure that was there, because I know it's a new program, so we're all trying to figure that out. So good question, Ken. Thank you for that one. That's all the questions I think we have. And Jordan, thank you. This has been awesome. Anything else to leave with these guys that may help them, you know, getting some of their folks into SelectRx?
No, I don't think so. I prefaced it at the beginning. I really hate to say it's an easy sale, but I know that our partners that are live with us today have really enjoyed it. It's just an extra stream for them, and it has helped improve the retention, because there is, although we're not directly tied to that plan you just sold, you know, specific to you, there is that kind of relationship and just the kind of process of the call where they start to tie these all together. And so I know our other partners have seen it. I really hope you guys see it too. And just appreciate you guys in advance for launching this.
No, we really appreciate it. And again, if you guys need more information on this, please reach out to us, support@askhpm.com, and we'll get you set up. It should already be launched and loaded in HPM Shop. I know that Jordan is tracking it. So I would love to see the first people kind of use this. But one of the biggest takeaways that I'll say today is, if you're concerned about retaining your clients, this is another hook. This is another hook into your client base to ensure that the stickiness stays, because they're not going to be sniped at the pharmacy, Maybe the pharmacy has a relationship with another agent. We've seen that before. Maybe there's somebody setting a table outside and they get sniped that way. So if you're really, really, really looking to hook your clients and keep them on your book of business, this is another way to do that, because they're going to get their medications included and mailed to them, already organized and set. And by the way, you will become a huge fan, or your doctor will become a huge fan if you're working with a physician and you share this program with them. They're going to love you because their patients are going to get healthier. Their patients are more compliant. You know, there's less hospitalizations because of mismanagement of medications. And you look like a superstar to some of these doctors that you guys are working with. You know, you can get some really big pushes behind this thing, which should get you more enrollments, you know, from your physician. You know, why would they work with you versus another agent? Is because you're going to increase their scores, their cap rates, and they're going to get bonus checks because their medications are managed. And this is one of the secret weapons, I think, that physicians, you know, once the word gets out about you guys, you're going to blow up. So Jordan, again, thank you very much for this. There's a couple more questions in here. I'm going to answer really quick. Is there a relationship between SelectRx and GoodRx? No, that's two separate companies, correct?
Two separate. We do work. We do work with them.
Oh, you do? Okay.
That's just to drive marketing, and two separate.
Yeah. And then is there a cost for agent or client? The answer is no. There's no cost for agent or client. So again, you know, it's part of the pharmacy. It's just, you know, when you go in there and you select the pharmacy, a lot of you are just selecting the Walgreens and CVS that they're currently going to. Again, if they're taking 6 or more meds, this is what you want to say to them, is that script that Jordan explained to help them with their medication management, to make sure that they don't accidentally take 2 of the same pills in the same day. It's happened. There's terrible stories about all of that stuff. Lamont saying, where is SelectRx in shop? He found it. Okay, so good. Should be in the pharmacy section there, or somewhere towards the end of the enrollment process. And you can sneak in there and see it. So if you're lost, confused, don't know where to go, just reach out to us, guys. support@askhpm.com, 844-696-3975. We're happy to help walk you through that. Jordan, thank you for staying extra time over. We really appreciate you. We hope to have you back again sometime later in the year, if that's possible.
Absolutely.
All right. Thanks again. And thanks everyone for sticking on the call. We'll be here next Monday. Same time, same station. We'll see you soon. Have a fantastic, wonderful, and productive week. Take care.